Welcome to the Cancer Interviews podcast. I'm your host, Bruce Morton. You know, every type of cancer is serious, but some can be more lethal than others, especially if early detection is next to impossible. That is often the case for those diagnosed with lung cancer, and it was the case with our guest, Neal Augenstein of Washington, D.C. He overcame stage 4 lung cancer, and on this episode, we're going to hear his story. So here he is, Neal Augenstein. And Neal, welcome to Cancer Interviews.
It's my pleasure to be here, Bruce. Thank you so much for having me.
Thanks, Neal. And it's our custom to start off by learning a little bit more about our guest, which in this case is you. So if you would, tell us a bit about where you're from, what you do for work, and when time allows for fun, what you do for fun.
Okay. Well, I'm a 64-year-old guy, married with a couple of kids. I grew up right outside of New Haven, Connecticut. And I went to college down here at American University here in Washington, D.C. For the last 25 years, I've been a reporter with WTOP, which is the all-news radio station and now website, digital content provider in the nation's capital. And so that's what I've been doing for more than 2 decades. Since 2010, I've done all of my reporting on my iPhone. I was the first major market reporter in the U.S. to do all of his work on his iPhone. So that's sort of some of the things that I'm interested in. Before that, I was a musician. Actually, within the last couple of years, my old band from back in the 1980s did a reunion show. I was the lead singer of that. So music has always been important to me, as my family and my job at WTOP.
Now let's get to your cancer journey. And all of us sort of start out at the same place in that things were going well for us physically, and then something turns up that is abnormal, something that isn't quite right. For you, what was that, and how did it manifest itself?
Well, in September of last year, I found myself coughing, and I'm coughing right now, as a matter of fact. But if you'll stick around, you'll see that there's for 2 different reasons. The cough that I had there, at first I thought it was allergies, because there's, apparently I've got seasonal allergy. I'm allergic to pollen, etc. But it didn't go away, despite me taking several different medicines for that. I went to my doctor, who thought maybe it was pneumonia, maybe there was some sort of bronchial thing, and we prescribed some antibiotics to try to deal with that, and that didn't work. So after about 2 months, I decided that I wanted to get a chest X-ray. And I mentioned to my doctor, my father had lung cancer. He was a smoker for a long time, and I think I probably want to get it checked out. He was pretty confident that based on listening to my lungs and my general good physical health, he would be very surprised if it were lung cancer. But I'm glad that we persisted, because I got my chest X-ray. A couple hours later, he called me and said they found something suspicious. That we'd like you to get a CT scan, and I had that done a couple of days later, and that was also suspicious. So I realized that we were getting closer to finding out what it was. Like a lot of people, I started researching and trying to understand what it might be. And of course, cancer kept popping up as a possibility. But it was also possibly a whole bunch of other things. So I was keeping up hope that it was one of the other things. But and then eventually I had after a while, my pulmonologist said, "You know what? I think we're going to check you into the hospital because this isn't going away, and it's getting worse." And so that's how I ended up in the hospital at the end of November of last year.
And what were the chain of events from there that led to your diagnosis?
Okay. Even when I started with the bronchoscopy, even before I had, or when I had the CT scan, when that came back as concerning, the plan was that I was going to have a bronchoscopy with a biopsy to see what it was there. And while I was checked into the hospital, I had the bronchoscopy, and that evening, a doctor who I just met a few hours earlier in the operating suite said that it looked to him and it looked to the doctors who were observing that it was that they believed that it was cancer, and excuse me, but they also said we're very hopeful that it would be the kind of cancer that would respond very well to targeted therapy. So we're gathering a whole bunch of information now, and we're going to have a meeting with your oncologist and your radiologist and a surgeon next week, and we'll figure out what the plan of attack was. So while I got some news that I never wanted to hear, very shortly after that, I was reassured that there was a plan in motion, or at least there was a team in motion that was gathering information that would help to determine what my treatment would be.
By the way, we're confident you'll be able to learn some tips and tools to help you through your personal cancer journey. But first, we'd like to invite you to please give us a like, leave a comment or preview or review below, and share this story with your friends. Kindly click on the subscribe button below and click on the bell icon so you'll be notified when we release our next cancer interview. And if you or a loved one are facing a cancer diagnosis, please click on the link in the description and show notes below to check out our free guide, The Top 10 Things I Wish I Knew Before I First Got Cancer. So, Neal, with this diagnosis, you're not a smoker, are you?
No, I never was a smoker. My dad and my mom were smokers. I breathed my share of secondhand smoke until I was in my middle teens, but I've never had any sort of lung issues before. I guess and so I am one of the growing number of young, relatively healthy people who are being diagnosed with advanced lung cancer, and as you know, in many cases, in most cases, it's non-small cell lung cancer. That's the one that people who don't smoke or who are light smokers or are more prone to get. And also, thankfully, the biomarker testing showed that I have the EGFR mutation, exon 19 deletion, which is one of the more common adenocarcinoma mutations that are out there. And so that there have been different targeted therapies in the past that have been available for people with that exact mutation of cancer. And thankfully, and luckily for me, that drug, Osimertinib, usually known as Tagrisso, has been shown to be very effective for people. And after I was diagnosed with lung cancer and started taking Tagrisso, I learned in a very, very fortuitous way the successes that other people have had with that targeted therapy. I got hundreds of social media engagements, people who tell me that they've been on Tagrisso and it had worked for 10, 12 years for them. Other people who said that they have they had family members who were diagnosed when they were in their 70s, and they lived long lives with it. So I found that to be very reassuring, to hear from people who have gone through the same thing with the same drug. Luckily for me, I am in relatively good health, and so the side effects haven't affected me very much. And my oncologist told me that I would probably weather chemo or radiation very well too. But I certainly was very glad to just take one pill a day that I've been doing with my targeted therapy, and that led me to that worked better than I could have even dreamed. Within the first 3 months, by the time I had my first CT scan, almost all of the cancer in both of my lungs and the lymph nodes of both lungs was gone, was resolved. And amazingly to me, I hadn't even considered it a possibility, but it went so well that during a visit to my oncologist, he said, "You know what? I think we can now put surgery back on the table, and might be able to remove the original tumor in your left lung." I didn't realize it at the time. My question was, well, if the osimertinib is killing all of the cancer on its own, what's the benefit of doing the surgery? And he told me that removing the tumor, or more generally the lobe where the tumor lived, can go a long way toward preventing the cancer from coming back in the future. So that seemed to me to be a very aggressive way. I would continue to take my targeted therapy. I had the surgery in April on a Friday afternoon. Unbelievably, I went home the next day, and it's one blessing after another here, with things working as well as they possibly can. The one I didn't mention that when I started the Tagrisso, my cough was gone within a month. So I had several months where I wasn't coughing at all. Right after I had my surgery, my surgeon told me that, one of the side effects of the surgery is that you'll likely have a cough for a while, and that is true. So I'm coughing again a bit, but I'm confident that it will eventually, go away, and that this is it's much better to have a cough from surgery than to have it from tumors growing in both of my lungs.
Neal, I want to talk a little bit more about your treatment regimen, but I want to circle back to something that you'd mentioned earlier. I just wanted to clear something up. It sounds like when you mentioned the words biomarkers and mutation, it sounds as though at the root of your diagnosis was family history. Is that fair to say?
No. It actually is not. It is, that certainly would have been a possibility with some sort of inherited cancer, but the biomarker testing checks to see where what the mutations are, and it can also get a sense of whether it's hereditary or it's caused by something else, maybe, in the environment, or that it just happened. And my doctor specifically told me it was not hereditary, that it fell under the category of, something caused it, but it was not hereditary, which of course was a relief to me and my family members who also wondered if it might affect them at some point in their lives too.
Well, I'm glad I asked, and I'm glad that you cleared that up. And I want to now go to your targeted therapy. You went that route, and it looks like it has been that you made an excellent choice. Did you have other choices? In other words, you'd mentioned radiation and chemotherapy. Did you have other choices, other ways to go, or was this kind of a slam dunk, the only way to go?
Well, my oncologist, within the first couple of times that I'd met him, and who continues to impress and soothe and and inform me. He said, I sat down with with my wife, and this during the time after I had my bronchoscopy, and they said that it was likely cancer. At that point, it wasn't clear whether it was stage 3 or stage 4, because they knew that it was in my left lung, and they also knew that it was in the lymph nodes in the center of my chest. But there were still some more tests, a PET scan and a brain MRI still to be done to see whether there was any other spread. So he described to me what the two options were. If it was stage 3, if it was just in my left lung and in my lymph nodes in the center of my chest, then the standard of care was both chemo and radiation. And again, he thought that given my good health, that I would be able to, that would be the most aggressive way to deal with it. If it turned out that there was something else, someplace else, then from that meeting, the plan was going to be that I was going to go on Tagrisso, on the targeted therapy. Everything that I've read and heard since then shows that for stage 4 EGFR mutated lung cancer, the standard of care is osimertinib, the Tagrisso. It is not, that is according to the research continues to figure out what the next great drug or combination would be. But Tagrisso is proving to be the best choice for stage 4 EGFR lung cancer. Interestingly enough, there's ongoing testing right now that would add chemotherapy to the Tagrisso. Matter of fact, and I just talked with my doctor today, as a matter of fact, and I said, what are your thoughts about that? Is that a stronger, better way to prevent it from coming back? And his thought at this point was that introducing chemo now it would be sort of defeating the purpose and the benefits of the targeted therapy. And of course, the targeted therapy allows me to live a much more comfortable life right now. I don't think I've gone over the side effects that I have had with that. So let me just, at some point I've had a bad rash that looks like a bad case of acne. I've had acne for most of my life, so it didn't sort of shock me, but people often do have a rash on their face from this particular drug. It can also cause cracking of your fingers, your thumbs, some very dry skin. It can cause diarrhea. But and it can cause fatigue. Those, I do appreciate being able to take a nap each day. My work shift is from 4 a.m. till noon. So at noon each day, I take a 2-hour nap, which can't beat that. But it rejuvenates me for the rest of my day. The other symptoms, the other side effects, I have not had any major problems with it. So, if you ask me, whether I had any symptoms, I would say that I'm 95% symptom free. And if I didn't mention it, I should have. After both my targeted therapy, my ongoing targeted therapy, and my surgery, I am now no evidence of disease, temporarily cancer free, and my first CT scan the other day showed that there's no new disease any place. So, knock on wood, things are going very well.
Neal, it sounds like from a lingering perspective, the toughest part of your treatment, the part that's sticking with you now, albeit only temporarily, eventually it will go, is the coughing. Is that true?
It is. It's a nuisance. I mean, people who have cancer have, other people that have had cancer and live with cancer live with a lot more severe, pain, real pain, and other symptoms that are certainly more inconvenient than a little cough every now and again. I'm certainly not complaining about the cough. I trust it'll go away eventually. As a broadcaster, it does. Thankfully, most of the time I'm recording rather than going live, so I can always do re-record something. I don't have a cough button here at my home studio, but it really is not that big a deal. Actually, before I started my treatment, though, it was a big deal. I felt uncomfortable going out into a situation and putting a microphone in front of somebody and asking them questions, because I felt relatively sure that I would cough on them during an interview. So I did a lot of Zoom interviews during that period, and thankfully my employer was very willing to work with me on that while I was getting it figured out exactly why I was coughing.
Neal, we did a bit of circling back earlier, and I want to do another type of circling back here, because you had mentioned that you found out that your diagnosis was not tied to family history, which had good implications both past and future. You've also referenced how advances are being made in how lung cancer is being treated. So while on the one hand you are optimistic on kind of a micro level within your family, are you also feeling a certain bit of optimism on a macro level? In other words, what has sort of been good news for you can be good news for others going forward?
I certainly have learned more about lung cancer than I ever thought I would need to learn. And what I found very empowering for me is to try to keep up on the latest clinical studies that are going on, and to try to understand what treatments are in the works. I find that just the fact that, I mean, I've learned so many different things about different radiation techniques, about different. For instance, one of the challenges with targeted therapy is that eventually it stops working in most cases. So after a period of time, you would have to switch to a different treatment. That might be chemo, that might be a different targeted therapy, because genes the cancer can even mutate. And so what started out as being a non-small cell lung cancer can change to a small cell lung cancer. So some major lane shifts there. But I learned that there was clinical trials going on to come up with another pill that, when taken with my targeted therapy, would affect the on-off switch so that my drug would continue to work into the future. There wouldn't be a time when it would stop working. So, sort of those sort of treatments where, looking for monotherapies where it's, one pill that works by itself, or a combined pill where two pills working together or two modes working together. I'm amazed and thankful and, encouraged by the fact that there are things that are in the works. And, I've benefited from people telling me their success stories. So I'm hoping that my sharing that there are some amazing research and there have been some amazing developments might encourage somebody to go out and get screened, or just deal with a lingering cough or something like that. Not being too afraid of it. Obviously some people don't get screened because they're afraid that they're going to hear that they have cancer. Better to find out that you have cancer today than next week. Certainly better to find out today than 3 years from now, because the techniques are just continuing to improve. And I think we hear all the time about early screening being a benefit. I guess this was a lesson that I learned that I guess should be repeated as many times as possible. With lung cancer, if the reason that you get screened for lung cancer is because of a symptom, like for instance, in my case, a cough, or spitting up blood, or something else like that, that if there's a symptom that causes you to get screened, chances are pretty good that if you have lung cancer, that it has advanced already. That's because lung cancer can live very quietly. You can have a tumor in your lung for a good period of time without it causing any symptoms. So that makes it even more important to get screened before you have any symptoms. In my case, it took a chest X-ray, and a chest X-ray showed a big honking mass, but a CT scan is able to look down into the tiny, centimeters or millimeters, and can identify something that would be potentially a problem early enough so that it could be removed with surgery, or it could be removed with radiation or something much less invasive, and with a much better prognosis than stage 4 cancer.
Our guest is Neal Augenstein of Washington, D.C. He is a survivor of stage 4 lung cancer. And Neal, we're going to wrap up now. Usually we wrap up with one question, but I'm going to turn this into sort of a two-parter, because I think in this situation, my follow-up question is merited, because it is part of the overall scene with lung cancer. But my first question is, if you ran into somebody who had just been diagnosed with lung cancer, and if you had a message for them, there might be many things you'd want to say to them. You've already talked about the screening piece, but if there's one other thing that you would like to impart to somebody who had just been diagnosed, what would it be?
Be hopeful, be involved, learn about the disease. I think the more that you learn about it, and the more that you learn about the possible treatments, and the fact that in many cases there are Plan A, Plan B, and Plan C already in place, and other ones that are still being developed, having that information in the back of your mind, at least to me, is very reassuring. So I think that I haven't looked at Prognosis. If you look up lung cancer, you see something about 5 years, as an expected, as a marker for a lifespan. I really haven't paid much attention to that. I'm going to keep learning all I can. I'm going to be a very good patient. I'm going to be optimistic. I'm going to enjoy the support of my family and my friends and my employer, and I'm going to just keep living, as well as I can. And thankfully, I'm living. I really am living very well, and the realization that I have lung cancer is back, toward the back of my mind, a lot further toward the back than it was, just 5 or 6 months ago.
Neal, the second part of my question involves people who haven't been diagnosed with lung cancer. And I want to give them the benefit of the doubt. I think a lot of them don't mean any harm, but unlike other cancers, there is this unmistakable stigma that is attached to lung cancer, in that a lot of uninitiated people, and again, there might not be any malice on their part, but there are many instances, and I hope this hasn't manifested itself too many times with you, but there are many times in which somebody's diagnosed with lung cancer and somebody will say to them, well, how many cartons of cigarettes do you smoke a day? I don't know if you've been hit with that, and I certainly hope you haven't, but there are those who have. So what would your message be, not to those diagnosed with lung cancer, but just to the general public regarding this stigma?
Well, one of the reasons why I thought I didn't have lung cancer was that I never smoked. So, and the more I read, the more I learned that there are a lot of people being diagnosed with advanced lung cancer who have never smoked. I did, ironically, used to be very, I was rude, I guess, to people who smoked in my general vicinity. I felt it was an invasion on my privacy and my comfort. I feel now for people who have been smoking, I do think it's important for people to realize that anybody who has lungs can get lung cancer. There's more and more people who have never smoked who are getting it, and I think that the reasons why are still to be determined. But I really do think that when if you have a chance to be screened, if just keep it in the back of your mind, and if a CT scan is a really wonderful thing in terms of shedding a lot of information. If it turns out clear, great. No harm there. If it shows up something that's small or just beginning, having that head start really can make a big difference in your long-term health and the challenges, or hopefully fewer challenges that would present themselves in living with that kind of lung cancer.
Wise words, to be sure. Neal, we want to thank you very much for an eloquent a bit of storytelling on your part, both past, present, and looking ahead to the future. Really appreciate it. And Neal, thanks so much for being with us on Cancer Interviews.
My pleasure. Thank you for having me, and thanks for the great work you're doing and helping people share their stories.
Thanks so much, Neal. And that's going to wrap up this episode of Cancer Interviews. We want to remind you, as we always do, if you or a loved one are on a cancer journey or may be on one, you are by no means alone. There are plenty of people out there, just like Neal, who have words of advice that can be uplifting and can be informative and inspiring. So until next time, we'll see you on down the road.